Good morning, everybody. My name is Jim Aiello. I'm the director of the Northeast Addiction Technology Transfer Center. And today we're going to be talking about ethics in addiction treatment, which I subtitled Values in Action. There's a few housekeeping things first that we need to take a look at. This slide was up on the screen for a while, so if you've logged in earlier, you've seen these various audio options. But take a minute now to look at them again. And notice the difference between option one, which is to use your computer headphones or speakers to listen, and your chat function, which will be very important as we go along to participate in the discussion. Or option two, if you do not have that capability available, you can listen in by calling the numbers on the screen there, 1-800-882-3610, and then the code 835-3003#. If you use that option, or if you use your phone at any time during the discussion, make sure that you mute when you are not talking. When you're talking, of course, you should unmute. But when you're not talking, if you would mute so that we don't hear any background noises, you may be doing a little something else at your desk while you're watching this, which is fine, but sometimes we can hear things in the background, so that if you mute, that would eliminate that problem. And if you want to join the conversation by phone instead of chat, you can use the call-in line as well. And if you're having any technical problems, you can call tech services at 1-800-504-5379. A couple of other housekeeping things we have to mention before we begin. The first is that there was a pre-form that you were when you registered that you filled out. That was called the Government Performance and Results Act, or GPRA form. This is very important to us at the Northeast ATTC. Since we're a federally funded agency, we really need to have this survey filled out. So hopefully all of you did that. Now at the end, you're going to receive a knowledge survey, which will also include a post-GPRA form. The knowledge survey will be emailed to you, and it will be emailed to you following the second half of this training, which isn't until April. This is actually a 3-hour training spread out over 2 sessions. We're going to do an hour and a half this morning, and then an hour and a half in April. And we already had a question this morning about when you get your certificate, and you get it at that time. In April, when you fill out the knowledge survey and the post-GPRA form, you will get, within 1 business day, your certificate, and that'll be emailed to you. So we'll get that to you as quickly as we can. Okay, in terms of webinar technology, the only thing that I'd like to remind you about is the use of your chat function. We're going to have a couple times when you'll be able to join the discussion. If you're not on the phone, the chat function, we can receive your questions or comments, and Josh, our technician today, will read them to me and I'll repeat them. If you do have a phone, we can patch you in that way. And also, we're going to do a little poll later where we'll simply ask you to chat, agree, or disagree when we do that. I wonder if we could take a few minutes to do some introductions. Oh wait, let me talk about the. Well, let's do the introductions now, even though I think originally I planned to do that later. After. Well, let me do the learning objectives first. Getting a little confused here this morning. Okay, here's our learning objectives for this ethics webinar. Participants will be able to define ethics. Now, when I say you'll be able to define ethics, we'll find out in our discussion that while ethics is describable, it's not exactly definable. But we will give you a working definition of ethics with the caveat that ethical systems and ethical standards are more complex than can be captured in a simple definition. Secondly, we're going to take a look and understand, hopefully, the role of professional association and agency codes of ethics. And this is an attempt by professional associations and provider agencies to codify standards that can help guide a professional's behavior. Then we're going to examine the relationship between ethics and the law. And they haven't always had a friendly relationship, as we'll see. Then we're going to understand and appreciate the importance of professional boundaries. And the importance of professional boundaries, as you know, is very high in addictions treatment. And we'll take a look at those in some detail. Hopefully we'll demonstrate knowledge of federal, state, and agency regulations regarding confidentiality. And again, while the regulations can be clear when you read them on a page, applying them in certain situations can be a little tricky, and hopefully we'll have a chance to discuss that. And here's some more learning objectives. We're going to identify some important legal considerations that affect clinical practice. We want to try to avoid any legal potholes that may be out there. Not always easy to do, but we'll discuss that. We're going to apply ethical standards to clinical record keeping. Now, clinical record keeping, I know, is everyone's favorite chore, and there are ethical standards that go with clinical record keeping, and we'll take a look at those. And then we're going to articulate a simple model for making ethical decisions. Again, making ethical decisions is not a simple thing, but this model can help guide us in terms of how we reach ethical conclusions that we can feel some confidence with. Okay, now we'll do the introductions, now that I think I have this figured out. What I'd like to do is call on all of you individually who have voice access to introduce yourself to the group. And if you're using the chat function, just submit your introduction and we'll read it to the group so that we know who's on the webinar with us this morning. And if you could simply include your name, your agency, your position, and maybe one thing you'd like to get out of this training. That would be very helpful. So I'm going to ask those of you that have phone capability to go ahead and open your phones now and to let us know verbally who you are, what your agency is, what your position is, and maybe one thing you'd like to get out of this training. And if you have the chat function, go ahead and submit by chat, and we'll read those. I'm getting a question here. Ask a question button. Oh, okay. The chat function is really ask a question. So if you would, I've been calling it chat, but if you press the ask a question button, that'll get you through on the chat line. Okay, do we have anybody who wants to introduce themselves? Okay, we're not getting anything on the phone. Are we getting anything through chat? Is there anyone out there? Okay, we're just going to continue then, and possibly we're having some technical difficulties or... oh, okay, we do have some things coming in. Okay. We're having some introductions coming in through the chat line, so that's good. Josh, who do we have first? Okay. We're going to do this a little differently. I think we're going to get some written communication going here. All right. So while we're waiting for we'll come back to your introductions in a minute. Here's something I'd like you to ponder for a second. We're going to start, when we talk about ethics, of course, we know that men and women have been struggling ethically since the beginning of time. And we're not going to go all the way back to the beginning of time. We don't have enough time to do that. But we will go back to Aristotle for a minute. And I'd like you to consider this statement from Aristotle. Aristotle once asked his students, who should we hold in higher esteem? The person who with great effort does the right thing, or the person for whom doing the right thing comes easily? I want to ask you to think about that a minute, and maybe we'll get some introductions here while we're having you think about Aristotle's little dilemma that he put to his students those many years ago. Okay, we're still getting some introductions, or shall I?
Hello?
All right.
Hello?
If you pass a few over, I'll... Oh. Okay. Okay. I'll check my other list here as well. Make sure that we got the... Okay, I have Marie Hanna is joining us. Holly Hagel is joining us. And Elka Hannel
Yes.
is joining us. And there may be some others, I guess. Are there any verbally that we need to hear from? Okay. All right. Well, since it looks like we're not going to have any verbal or ask a question easy participation here this morning, I will discuss Aristotle's statement, and we'll see whether the technical stuff can catch up with us later. Now, the question at first glance, who should we hold in higher esteem, the person who with great effort does the right thing or the person for whom doing the right thing comes easily, can be taken, I guess, in two ways. Usually we honor people who do things that require great effort. And if somebody is in a particularly difficult situation and they have to really think it through and do something that requires great effort, we usually honor that person. Aristotle, as you might suspect, took a slightly different view of this. He actually felt, and actually many of Aristotle's students felt, that it was the person who with great effort did the right thing. That's the person we should hold in highest esteem. But Aristotle, as you might conclude, took the other position. He felt that the person for whom doing the right thing comes easily is the person we should hold in highest esteem. And of course, the reason for this is that Aristotle put a lot of stock in people developing good habits of thinking and acting. And he felt that if you started young and developed these good habits, then when it came time to make even a very big decision, one that might be on the surface very difficult and maybe even threatening to you, you would make that decision easily because that was your habit. You had learned and embedded in yourself the ability to think things through and to do the right thing. And this wasn't new for you. Okay, we have a couple of other people that have joined us. Tony Polizzi, I believe this says. Polizzi, sorry. Let's see. Renee Jones, Laurel J., and Alicia Furman. Okay, so we have some folks that were able to get in through the chat and introduce themselves. Thank you for being with us this morning. So that's what Aristotle thought. So I think it points to the fact that the more we practice acting and thinking ethically, the easier this comes for us. If everything is a big deal and we've never thought about this before, then maybe it does require great effort to do the right thing. I don't know what you thought of that, but that's what Aristotle thought of that. Let's talk for a minute about a couple of ethical theories. This is my philosophy section of our webinar. And these are just a couple of ethical theories, maybe rather poorly presented, but maybe worth thinking about. The first ethical theory, okay, wait a minute, we're getting, okay. All right, in a minute I'll be asking for the phone. The first ethical theory I want to talk about is called teleological ethics. It comes from the two Greek words telos, and logos, which basically means the science of the ends of things. And basically this is sometimes called utilitarianism or utilitarian ethics. And how this sketches out is as follows. Ethical principles are clear enough, but the actions themselves can be somewhat relative. Now, in teleological ethics, the person seeks to maximize the good, you've probably heard this before, and minimize the evil. And then the end justifies the means is the little tagline that usually goes along with teleological ethics. And a problem can be, of course, that this can lead to rationalization. Now, another school of ethical thought is called deontological ethics. Again, from the Greek deon, which means obligation or duty, and logos, which means the science of, or the study of, obligation or duty. And in deontological ethics, ethical principles are absolute, so that there's great clarity there. And we'll talk about this in a little bit. The ultimate principles determine the rightness or wrongness of an action. So people who are pure deontological ethicists are guided by ultimate principles. And immediate outcomes are not the determining factor. So you may have a bad outcome to begin with, but that's not an issue for somebody who practices pure deontological ethics. It's not the immediate outcome. It's the fact that the ethical principle is honored, and the thought being that the world is a better place if these ethical principles are pretty immutable and that they're honored all the time. Now, as you can see, this could also lead to rigidity. Now, there was an actual incident that happened during the war in Bosnia, which kind of, I think, illustrates these two ethical theories. As you know, there were the Bosnian Serbs and the Bosnians, and the Serbs were on the offensive. And there was a non-governmental agency a non-governmental organization, an NGO, in Bosnia at the time that was trying to provide medical services to the Bosnian people. And one day when they were going over their items of expense, the accountant on staff said, "What's this big expense under miscellaneous?" And so the director of the program says, "Well, that's the money we have to pay to the Serbs in order for them to allow our trucks with medical supplies to get through the mountains so we can get our medical supplies into our clinics to treat the Bosnians, who, incidentally, were being attacked by the Serbs." So you can see that there's a little bit of an ethical dilemma here. In effect, what was happening is that this official had decided that in order to treat the people who were the victims of the war, he had to pay off the perpetrators of the war. So this was a true ethical dilemma, and probably is a little bit more illustrative of the teleological approach, that he felt that the end of his action, which was the fact that people who were victims of the war could get medical treatment, outweighed the fact that he had to do something that was actually kind of a little bit bad. He had to pay money to the people who were actually causing the injuries in the first place. So you can see that ethics is not always easy and clear, and you can certainly argue with that. Somebody coming at it from a deontological standpoint might have simply said, well, wait a minute, we can't be paying bribes, number one, bribes are wrong, and we certainly can't be paying bribes to the perpetrators of this war. So that would guide their thinking and say, well, we'll have to think of some other way to get medical supplies through, or we'll just have to kind of live with the consequences of this because we don't want to violate those principles. Okay, so here's a definition of the undefinable ethics, which at least will be a working definition for us. Ethics refers to standards of behavior that tell us how human beings ought to act in their various personal and professional roles. And for us, of course, right now, we're most concerned about professional roles. So let's think about that for a minute. Ethics refers to standards of behavior that tell us how human beings ought to act. You can see right there that we're not talking about things that are really chipped in stone. We're not really talking about the Ten Commandments here. We're talking about standards, guidelines that help us to guide our ship through the shoals of human behavior in a way that preserves personal and professional values and roles. And so it isn't simply easy. Here's a good definition. It's a good working definition. But it's not exactly easy for us to define ethics as though we can put a fence around it and say, well, here it is. We know what it is all the time and in every circumstance. Here's a little case for you to consider, and I'm not sure if I'll be able to get your feedback on this or not, but it would be nice if some of you have some comments on this as we consider this case. I call this the case of the mall dentist. And this is an actual true story. This actually happened. An office worker chipped his tooth at lunchtime on a Friday. How annoying that can be, you can imagine. The jagged tooth is causing some discomfort, and so he calls his dentist, but it's too late in the day and he's unable to be seen until Monday. So he decides to stop at the mall after work and visit the walk-in dental clinic there. The dentist sees him and files down the jagged edge of the chipped tooth. Before sending him on his way, he writes a prescription for Percocet, just in case you experience any continued pain or discomfort. Now, there are a couple questions here, obviously. One is, are there any ethical issues to consider here? And if so, how should they be resolved? Okay? So think about that for a minute, and if you have some comments that you can send in through the Ask a Question button, or I don't know if we're able to receive phone contact at this point. We'll come back to that in a minute. I'll show you the next slide for a minute, but then we'll come back to this case of the mall dentist. Okay, now ethics is not the same as these things. It's not the same as personal feelings. You can have strong personal feelings, but that's not really ethics. It's not even the same as religious beliefs. It's not the same as the law, as we'll certainly see. And it's not even the same as cultural norms or science, though all of these things can and certainly do inform ethical thinking. So ethics is not the same as these things, but all of us certainly use these things when we're putting together our own ethical approach to decisions that we have to make. So it's not to say your personal feelings don't enter into this, or your religious beliefs, put those aside, or the law is not important, or cultural norms, which, as you know, can be vastly different. And as clinicians, and you're practicing in a multicultural world, cultural sensitivity is something that you have to foster and that you have to develop. So that you can maneuver around sometimes in other people's ethical systems as well as your own. And even science, which can certainly guide us and is very important, is not the same as ethics. But all of these things can play a role. Now let's go back to our case, the case of the mall dentist. I don't know if we have any comments or phone comments. If we do, we'll hear some. And I'm going to try to read Josh's writing here. Okay. All right. So someone has said, in terms of ethical issues here, that they think the dentist should provide safe transportation for the patient, because if the patient decides to take the Percocet, they're going to be under the influence to some extent, and maybe the dentist should think about providing some safe transit for this person. So that could certainly be an ethical issue here. We don't want people going out onto the highway impaired or disabled in any way. I see some other writing going on there, but I'll add a few comments of my own. One of the things I think that jumps out at me here from this case is, why would the dentist just take out a prescription pad and start writing a prescription for Percocet? The patient didn't ask for it. The patient didn't present in intense pain. He presented in discomfort. He could have asked the patient after he filed down that tooth, well, how does that feel? Are you still in discomfort? Maybe the dentist could have said, if you're in a little bit of discomfort, take a Tylenol, take an aspirin. Okay, we have another comment here. Somebody's thinking about this as well. Okay, the dentist does not have medical background or patient or his addiction history. And that's certainly something I was about to get to, so you're thinking in the right direction. And I think this is something very uncommon for dentists to do, which is to say, before I write you a prescription for a potentially addicting substance, let me either have you fill out this little questionnaire, or let me ask you a few questions about your own addiction history. At least in that way, the dentist has a chance to do a little screen and to see if the person has had any problems with alcohol or drugs in the past. So there's certainly a couple of ethical issues, I think, that arise here. The dentist is not simply a workman, or it's not like an auto mechanic, although auto mechanics certainly have to practice ethics as well, maybe more so than many. But he has the obligation to interact with his patient and to know the patient, even if briefly. This is just a brief contact. And he certainly has the obligation to treat the patient's discomfort in the most limited way possible. If the dentist, as I said, if he could say, would aspirin or Tylenol be okay? And then certainly would have the obligation to talk to the patient about their history of alcohol and drug use, to see if there's any possibility that by writing this prescription for Percocet, he might be putting this person in danger of relapse if they're in recovery, or he may simply be on the circuit, as many dentists are, to help an addict get their drugs. So these things can be very complex. Okay, we have another comment coming in here. I think Josh's handwriting is improving somewhat. I think the dentist acted appropriately. He was a practitioner and made the call as a dentist. Okay, well, I see we have somebody who has a little different view, and that's always fine. It is true to say that as a dentist, it's certainly his prerogative to write a prescription. My only point is, has he done enough investigation in this case to make sure that he's doing this safely, that the prescription is necessary, and that the patient will not be harmed more than helped by his writing the prescription? So you can begin to see then how an ethical decision, I'm sure the dentist did not pause in this particular instance, because, in fact, I can now reveal I was that office worker who went to the mall dentist. and I can tell you that the dentist did not, in the purview of his workday, maybe it is unreasonable to expect that he says, okay, everything that comes before me is an ethical decision and I really need to think this through. But he did act, I thought, rather precipitously. In fact, after he wrote the prescription for Percocet and handed it to me, I said, I don't really need this prescription. I'm not really in that much discomfort. An aspirin or a Tylenol will do just fine. But he went back to his prescription pad and he wrote me a prescription for Tylenol 3, which is Tylenol with codeine in it. So he was not going to be easily put off, even by my protestations, that I was really feeling fine. And all I wanted him to do, and which he did and did very skillfully, was to file down that tooth so that it wouldn't be rubbing against my tongue and causing discomfort all weekend. Okay, here's a comment. Following your comments, the dentist could have done a brief screen to assess the pain. And I think that would also be legitimate, even if he did a pain screen. He didn't necessarily have to do a drug and alcohol screen. He could have simply said, okay, I just want to do a brief screen to see on a scale of 1 to 10 or 1 to 5, whatever, or whatever other little screen he might have to see how much pain the patient was in. And again, I think to act ethically in medicine in general, the least but effective intervention is probably always the best way to go. Okay, perhaps that's enough about the mall dentist. I should let him off a hook, I guess. He did me a favor that day. And we did, the ethics is not the same as, these things. Okay, and now another case for you to consider, where Josh is going to be writing away over there. This is called I Can't Feel Your Pain. Gary is admitted to the emergency room for an accident while driving under the influence. He has broken his leg in 3 places and shattered his elbow. Not only does he have a blood alcohol level of 0.15, but he admits to the ER physician that he has been abusing OxyContin. Since he is going to need surgery, he wants to make sure he gets enough pain medicine afterwards. He says he may need a higher dose due to his drug abuse. All right. We'll stop this case here for a minute and ask these questions. Should this information influence the treatment plan in any way? And are there any other morally relevant facts the ER doctor and surgeon should consider before the operation? Again, here you have a drug addict, an admitted drug addict, who was in an accident because he was driving drunk. And he comes in and he has multiple very serious injuries that are going to require surgery. And he does have the presence of mind to say to the doctor, geez, because I'm abusing OxyContin, if you're going to give me pain medication, I'm going to need a lot more than you usually give in order to get any effects from it. And so again, this sets up an ethical dilemma for the treating physicians. So should this information influence the treatment plan? I think we would all agree that the answer to that is yes, it should. But exactly how should it influence the treatment plan? And what other morally relevant facts should the doctors consider before this operation? Now, we may be getting some comments coming in, but in order to, so that we can keep moving along, And I don't necessarily like to give my opinions first, but I want to hasten to add that my opinions are not necessarily the right answers. So this is not a question. Ethics, as I said, is complex. And it's not simply a question of, okay, now here, you've had a minute to think about this, now I'm going to tell you the right answer. But this is my thinking on this, and I think that if you have opinions to the contrary or other nuances or other ways of looking at this, we'll definitely consider those and read them out. I think here the issue becomes pain versus the fact that this person is a drug addict. And the question becomes whether or not the treatment plan should say, okay, the pain is primary. We can't ask this person to be in excruciating pain after surgery, so we're going to have to give him a higher dosage of pain medication than we might give the average patient in this situation. And so in order to treat the patient with respect and even compassion, it would seem to me that the surgeon has to go ahead and prescribe a higher dose of pain medication than he normally would. Now, what about does the drug addict who is in, okay, here's a comment, and I'll read this. Okay, yes, this should impact into the treatment plan, the person says. And I certainly believe it should. And I believe it should in that way. That just because the person is a drug addict who is in the hospital for driving drunk, so this isn't a person who completely tugs at our heartstrings, and yet those of us who know about addiction, it may tug at our heartstrings a little bit more than the general public. Nevertheless, it's not about personal feelings, as we said earlier. It's not about religious convictions, that this person is a sinner and he should suffer because he's a sinner. It's not about our culture, even. It's not even about the law. He broke the law. So again, he should probably be punished for breaking the law, but not in this context, not in the context of the hospital. And it is, in this case, a little bit more about science. It's about knowing how much medicine is going to be needed to control his pain if he is abusing OxyContin as he says he was. And so the surgeon certainly has the option to give higher doses of medication. Okay, we have another comment coming in here. Okay, medical providers must treat the person, not his addiction and disease. And I think that does play a role here. So the medical provider has to consider, first and foremost, the fact that somebody coming out of that major type of surgery is going to be in pain, and it isn't really in the interest of the patient to allow him to be in that amount of pain when we can control it. Now, the second question says, are there any other morally relevant facts the ER doctor and surgeon should consider before the operation? And I would say, yes, there is. I would say that even though this is not an addiction treatment center, even though this is a busy hospital and an emergency room, and maybe this is just a bias of mine coming from somebody who has worked in the addiction treatment field for most of my career, over 30 years, I think hospitals have a kind of a teaching opportunity in situations like this to begin to confront the patient in a way around their alcohol and drug use. And here's another comment. I always like to interrupt my comments with yours. The patient should be considered for addiction treatment, but treat the injury first. Well, that's kind of, I guess, what I was going to say. So whoever chatted in or that comment was thinking on my wavelength and kind of stole my thunder. That the person should be, either before or even after the surgery, talked to about his addiction problem and offered either addiction treatment. And I don't know, we don't have time to talk about this here, but there's a wonderful screening and referral to treatment tool called SBIRT, Screening, Brief Intervention, and Referral to Treatment. This would be a perfect opportunity for those of you who know about SBIRT to apply an SBIRT intervention here with this patient, because it's tailored to the emergency room setting, to the hospital setting. So certainly some attention should be paid to this person's addiction. Oh, there's a phone person? Okay. Let's see if we can get a comment on the phone.
Hi, this is Holly.
Hi, Holly.
Hi. This is a great case study, and I had just chatted, but I thought if you wanted to test the phone line, I'd call in too. That I really do think they had an obligation to involve a DNA specialist along the course of treatment, but somewhere along the line, because of the circumstances and also his prior history.
Right. I think that's definitely true. You just can't glide over the fact that this person has a pretty serious alcohol and drug problem, because otherwise the person is at risk to keep coming back, not in the good way that we sometimes use that term in the addiction treatment field, but in the bad way. He'd keep coming back to the emergency room with other accidents or other conditions caused by his alcohol or drug addiction. Okay, thanks, Holly.
Sure.
Okay, now here's a little more pain for you to consider. After the operation, the surgeon does prescribe an unusually high dose of pain medication. The nurse who is distributing the meds says, "This is ridiculous. No one would need this high of a dose. His pain can't be that bad. I'm uncomfortable giving it to him." Again, any ethical issues here? What should the nurse do? You may have some comments or thoughts about the nurse involvement here. I think the first thing that most of you would say that this isn't the nurse's decision. This is really the doctor's decision. But if the nurse feels that she's in an ethical dilemma, which she may feel, then she may at times feel that she has the right to take action on her own, that this is ridiculous, as she says. This can't be right. No one needs this high a dose. So she needs to at least have we need to at least give her the respect of resolving her ethical dilemma, or the opportunity to resolve that dilemma. And we may not resolve it for her, but we may want to give her that opportunity. Okay, here's a comment. As this patient is suffering from addiction, different standards should be applied than in a normal patient. Exactly. What we have to say is that the doctor, in this case, made the decision to give the higher dose. So the first thing that the nurse needs to consider is that this is a doctor's order. Now, she may feel it's an order in error, because much as we hate to consider this, that occasionally happens, that the doctor's handwriting is bad, maybe even worse than Josh's here. And sorry, Josh, I just can't resist. And so maybe the nurse thinks it's an error or a mistake, and that therefore, at least for the first dose, she's not going to give him that much until she can verify this. So there's all kinds of things that might be going on for the nurse. But the ethical issue, again, here, and here's another one coming from Josh, is the nurse trained to evaluate addicted patients? Good question. And the answer may be no, but again, this points to the fact that primary medical professionals can certainly and should certainly be trained to some extent in addiction-related issues. And there are efforts around the country going on right now. A very big effort right here in Pittsburgh, which involves IRETA, which is the parent agency of the Northeast ATTC, where undergraduate nurses at the University of Pittsburgh are all being trained in the use of the screening tool I mentioned before, screening, brief intervention, and referral to treatment. So that means every nursing student graduating from the University of Pittsburgh in perpetuity, because this training is going to be embedded into the curriculum, and eventually the Pitt faculty will be teaching this curriculum. So every nurse graduating from that school of nursing in perpetuity will have the ability to do screening for addiction problems. So that's an aside, but I think it's an important one, and maybe one that we'll see more and more commonly in hospitals as we move forward. So again, here it seems that the nurse needs to consult with the doctor, needs to verify the treatment plan, but then needs to go ahead and treat the pain, because that's her primary task as a nurse. But if she does have ethical qualms, or if she feels like, I don't know whether I'm reading this prescription correctly, she certainly needs to consult with a doctor, and she certainly deserves that amount of respect. Okay, here's another solution perhaps for the nurse. The nurse should go to her frontline supervisor with her concerns. And certainly she can do this, even if she decides, okay, the doctor says I have to do this, so I'm going to do this. She may still need some time to talk to her own supervisor to work the issues through for herself, and that's certainly reasonable. All right, that's enough pain for now. Okay. Taken to the cleaners, we have an example here of what I call the horns of a dilemma. And I don't know, this was always one of my favorites because, again, it gets to the point where one person's ethics can be different from another person's ethics. And this little vignette, I tell you, only because I think the first line of ethical thinking is what I call the smell test. You know, is there something fishy about this? Is there something problematic here? Even in our previous case with the nurse, I think we'd at least have to give her credit because she said, wait a minute, this looks like way too much medication for this patient. And she may have even been thinking, this could harm the patient if I give this patient this much medication. And so her smell test was not a bad one. It was saying, before I act, maybe I need to take some steps to make sure I'm on the right path. And I would say she's certainly to be commended for that and not questioned as to her intentions. So here's another little smell test for you. Do you think there's something fishy about this? And the reason I like this one is because this little vignette appeared in one of the trade publications of the addiction field very publicly. It was written by a chief executive officer of one of the best-known treatment centers in the country. And he writes this little vignette and puts it out there very publicly. But when I read it, I thought, I wonder about this. And so see what you think. And it goes like this. He says, I won't give you the person's name who wrote this, although this is in the public domain, and you know, maybe you have even read it yourself. The name of this is called At the Cleaners. And here's what he wrote. He said, recently while I was visiting with an alumnus, actually laying the groundwork for a solicitation, I know that's a surprise to all who know me, he shared a story with me. And here's the story. He said early in his recovery, he was down to his last $10. He figured he would use $5 for dinner that evening and $5 for lunch the next day, in anticipation of receiving his first paycheck from a new job the following afternoon. So he only had the $10. He had to cover 2 meals, but he was getting his paycheck at the end of the afternoon, and so he'd get dinner tonight, lunch tomorrow, and everything would be cool. Much to his chagrin, a friend of his who had even less approached him prior to his dinner and asked if he could spare him some money for food. The alumnus shared with him that he was down to his last $10, $5 for dinner for himself and $5 for lunch the next day, but he was so moved by their friendship and the other man's desperations that he said, why don't we both go to dinner? I'll spend $5 and you spend $5. They agreed and had a nice dinner. Well, so far, so good. Sounds like a warm story. Sounds like a nice thing to do for someone. But then it goes on. The alumnus figured that he could tough it out until he got paid that following afternoon. So he started the next morning at his job at the dry cleaners. Lo and behold, as he was doing his routine work, he noticed that in one of the shirts there was a $5 bill, which he was able to use for his own lunch that day. As a result of his finding, he realized giving his friend his last $5 the day before proved to be no sacrifice, but rather enhanced a friendship. He shared with me how he realized that there are no coincidences, that God works through people, and that what you give away freely and generously, you always get back. Now, I don't know what you think about that, but for me, that didn't quite pass the smell test. My question was, why did this gentleman, given even the fact that he's in recovery and probably a good person, why did he have the right to the $5? When you drop your shirts off at the dry cleaner, they're under your name, aren't they? Why wasn't the $5 put aside for the person whose shirt he found it in? So you can see that even in this high-profile trade publication, somebody thought this was totally ethical, that there was no problem at all in using the $5. Now, I don't know, he didn't tell us, the author, whether the person replaced the $5 after they got their paycheck. Maybe that was part of it. It would have been nice to include that in the story if it was. But as it's written, it seems to me that especially God would not be in the business of giving $5 from one person to somebody else. It doesn't seem that God would be that arbitrary. If the person had been starving, possibly, but we're talking about the fact that he was only going without lunch here. Anyway, that's my take on this Taken to the Cleaners story, Horns of a Dilemma. I don't know if you have any other comments on that. I don't want to belabor it, but I always thought that was kind of an interesting little story, and it was in a high-profile publication. Let's talk for a minute about professional association codes of ethics, because all professional associations tend to have these. And certainly I'm sure that the professional associations that all of you belong to have codes of ethics. Most professional associations and licensing certification boards have these. They act as a general guide. Oh, wait, we have a comment here. Okay, and here it's a comment about the Horns of a Dilemma, and someone agrees with me. I think he wasn't justified in taking the $5, and I certainly agree with you. It didn't pass the smell test for me either. Okay, back to professional associations. Okay, so they act as a general guide, and this is important. No professional association code of ethics can tell you what to do in every circumstance. That's why your development of a way to make ethical decisions, to weigh things out, is very important. But your code of ethics can be a guideline for you. It can give you parameters. It can point you in the right direction, and that's very important. And they can spell out the mission and values of the profession that you're in. And that's important for you to know that mission and to know those values. And here's another comment. We can always interrupt for a comment. Okay, the ethical theory that allows for rationalization. We're back to the Horns of a Dilemma again. It certainly did seem to me that that's the one that was in play here. That the $5 was in the pocket and he needed it for lunch, so anything else was out the window. That's definitely the end justifies the mean for sure. All right. Okay, and when you sign on for a professional association, and this is important, you agree to be measured against the code. So it's not simply, you go, you pay your money, you take your test, you get your license, but you really have an obligation then to sign on and agree to be measured against the code of your organization. That's why it's important for you to read those codes. Sanctions could occur for violations. So if you violate the code, there could be sanctions involved. So that's important as well. You want to know what those are. Now, many organizations have codes of ethics, and not just clinical ones. Another comment here. Boy, Josh is working overtime. Okay, back to the Horns of a Dilemma. I guess it did interest some of you. Strange logic. It seems to be a distorted kind of perception of right or wrong. Yeah, it's a little bit too convenient. I mean, that was my feeling, and he didn't take the next ethical step, in my opinion, was to say, well, what if the guy who left this $5 in his shirt, what if that was his last $5? Of course, I guess he had enough money to get his cleaning done, maybe. But anyways. Okay, many organizations have codes of ethics, and not just clinical or psychologists or social workers or addictions counselors. And they have some similarities. And I'm going to read you just a few lines from a few organizations. Here's the Native American Code of Ethics, which some of you might be familiar with. And here's what it says. Never speak of others in a bad way. The negative energy you put out into the universe will multiply when it returns to you. I always like that one. Here's one from the South Dakota Department of Education. And this one says, not without just cause, deny to the students access to varying points of view in the classroom. So this one's upholding the student's right to disagree with the teacher. It also says keep in confidence information that has been obtained in the course of professional service, unless disclosures serves professional purposes or is required by law. Okay, I don't want to read all these. Here's the Code of Ethics. I thought this is an interesting group. The Code of Ethics of the Information Processing Society of Japan. Okay, and they have some very interesting ones as well. We shall respect the person and privacy of others. We shall give due consideration to cultural diversity in society. We shall honor facts and data. We shall honor contracts and agreements with clients and preserve the confidentiality of clients' privileged information. So that's from the Information Processing Society of Japan. Here's a code of ethics for teachers of Wicca. So even the Wiccans have a code of ethics. And it says in part, respect the confidentiality of your students first and foremost, but also respect the confidentiality of group members and other pagans and clients for whom you perform the occult arts. The only time that confidentiality is broken is if you feel that the person is in danger, either to themselves or to others in a physical or mental way. Okay, so you can begin to see that there are some actual similarities between various groups' professional codes of ethics. Similarities that we can relate to as people in the addictions treatment profession or as psychologists or social workers or others. Here's a policy that was developed, well, I'm going to leave that for a minute because I do want to talk about agency codes of ethics. Okay, many agencies have their own codes of ethics, and if you work for an agency, again, you need to take a look at those. They outline employee behavior that will be encouraged as well as the behavior that will not be tolerated. The violations can lead to disciplinary action or termination of employment. If your agency has such a code, make sure you read it and ask questions. Now, many of you may perfunctorily, I hope I said that right, sign off on an agency code of ethics. That's not good enough. You really need to read it. And if you have questions about it, you need to talk to the person in human relations or your supervisor or somebody who can explain to you what this means if you're unclear. Because again, when you sign on with an agency, you're signing on, you're putting your name down saying you're going to respect and uphold this code of ethics. And so that becomes very, very important. Now, I'm not going to read to you a bunch of agency codes of ethics, although we do have a few here. But here's one from the Women's Center of Beaver County, which is an organization just to the north here in Pittsburgh. And I think that what they say right up front is really a good thing to consider. They call it their professional boundary policy. They say, this policy offers general guidelines and provides a basis for making sound ethical judgments. However, it does not and cannot prescribe behavior for all situations. Occasions will arise which are not covered in this policy. They do not exempt the employee or volunteer from ethical behavior and upholding appropriate boundaries between staff and client. So what the agency is saying up front is that we can't conceivably think of every situation that's going to come up, but we can give you some guidelines. And if you act in the spirit of these guidelines, and if you ask questions about these guidelines, that will help you to make good ethical decisions as a representative of this agency. It won't guide you in every situation, but it will help you to do so. And I think that that's very important. So if your agency doesn't have one of these codes of ethics, it should. And you should advocate for that. For two reasons. Number one, of course, it gives more protection to your patients or your clients. And number two, it gives you some protection as well. And I think that's important to consider also. Okay, let's talk about personal values and ethics and fit. Okay, this is important. When you decide to formally enter a profession or seek a license or certification or work for a specific agency, make sure you fit. You need to work in an agency or in a setting that's a good fit for you and your set of ethical values. If your values don't match the values of your agency, don't accept a job there. And this is maybe hard to say in a time when jobs are hard to find. But I'll give you an example of what I call an ethical Hall of Famer. It was very interesting. This is an interview I did many years ago, probably about 25 years ago, of a person who came to our agency to apply. She applied for a job as a family therapist. And I knew her before. I didn't know her well, but I knew her professionally and knew her reputation well before she came in for the interview. And I was very excited about her coming in for an interview. I thought, this is great. It would be great for us to have her working with us as a family therapist. Well, we had the interview. It went very well. She was very strong. She had very strong family skills, and she understood family dynamics really, really, really well. She had been working with the drug and alcohol addicts as well, so I knew that she had that background. However, at the end of the interview, I had to say to her, I thought everything was going very, very well here, and I was very pleased. But at the end of the interview, I had to say, well, I need to tell you that it is the philosophy of this organization that addiction is a primary illness. It is not secondary. It's not really something that's the result of something else, but it's a primary chronic condition that needs to be treated in and of itself. And I want to make sure that you also agree with that view of addiction, because it's very important for us that we have that one single view when we're talking to our patients. Well, she paused for a minute. And I thought, well, wait a minute, this isn't so good. I wanted her to say, yeah, I agree. Where do I sign? But she didn't. She paused. And she said, you know what, let me get back to you on that. And so I said, this probably isn't going to turn out the way I want it. And sure enough, the next day she called in, and she said, I thought it over. And she said that she currently worked at an agency that didn't treat addiction as a disease. They thought of it more as a dysfunction or a behavioral condition. And they didn't really see it as a chronic condition or a chronic disease. And so she didn't think she would be a good fit at our agency. And I always remembered that, and that's why I call her an ethical Hall of Famer. Obviously, she was interested in working at our agency. She came out for the interview, and she was very enthusiastic during the course of the interview. But she determined in the end that there was a value or a point of view that she had, and she understood that if she brought that value into our system, that would immediately create an ethical conflict. That she would either have to lie and say, oh yeah, I sign on to this philosophy, or she would have to give her own feeling and opinion, which would be in direct contradiction to what the agency stood for. So she made an ethical decision not to accept a position at that agency. And that's why I call her an ethical Hall of Famer. And interestingly enough, after 25 years, I finally had the opportunity to let this woman know that she was my ethical Hall of Famer, because I had kept this anonymous from her and for everybody. Obviously, I don't mention her name, but I thought I'm going to tell her that she's my ethical Hall of Famer. And she was surprised to hear that. Okay. Now, this is what I'm going to call a values walk chat, although it's not going to be a chat. It's going to be hit that button that says ask a question. Okay, I'm going to throw up a series of statements, and I simply want you to type in the word agree or disagree. Okay, so there's going to be a series of statements here, and we're going to type in the word agree or disagree to see where you stand on these particular issues. Okay? And the first one, I guess they're seeing all these at once, but the first one is abortion should be prohibited except when the mother's life or health may be in danger. So abortion should be prohibited except when the mother's life or health may be in danger. Now, if you could quickly hit that ask a question button and simply type in agree or disagree, maybe Josh can give me a quick count. Or maybe not. We getting anything? Nothing. Okay. We have two disagree that abortion should be prohibited except when the mother's life or health may be in danger. Okay, anybody else? Three more disagree? Three what? Three total. Three total disagree with this statement. Any of the others want to declare themselves? It's totally anonymous. Okay. We have one in the room who agrees. Okay. I'll just leave that up a second. Uh-oh. Somebody's giving a comment. I just said agree. Oh, 4 disagree and 1 agrees. Okay, so one person does agree with that statement and 4 disagree. Next statement, The death penalty should be a sentencing option for capital crimes. The death penalty should be a sentencing option for capital crimes. If you could hit that ask a question button and just say agree or disagree, it would be great to hear you weigh in on this. You see how each of these is an ethical dilemma. The death penalty should be a sentencing option for capital crimes. I'm getting a few replies here. Usually when I do this live, I actually have people get up and walk across the room to the side that they, like the agree side would be to the left and the disagree to the right. And if any of you are trainers, that's actually called a values walk. It can be very effective because I've done this with groups of several hundred people where they're getting up and moving around the room. Okay, 5 disagree with this, and 1 agrees that the death penalty should be a sentencing option. So 5 disagree and 1 agrees. Okay, there's going to be a point to this in a minute. The next one is needle exchange programs should be funded by the government. Needle exchange programs should be funded by the government. So again, if you could hit your ask the question button and type in agree if you agree or disagree if you don't agree, we'll get a quick count and see how you feel about this. Needle exchange programs should be funded by the government. These are harm reduction efforts. So part of this is kind of a 2-part question. But the operative here, I guess, is should be funded by the government. So some of you may feel that they should be funded privately, but I'm not giving you that choice. This is a forced choice. Nobody weighing in on this one, Josh? Couple, okay. Okay, thank you. Okay, 1 disagrees, says the needle exchange program shouldn't be funded by the government, but 4 agree that they should be. All right. The next one is a scientist should be allowed to use live animals for research. Scientists should be allowed to use live animals for research. If you have an opinion on that, just type that in. We're getting the results, and this is a little bit like the Iraqi elections. It takes a little while to get them in. But that's okay. Not many people weighing in on this one. All right. Well, we'll move on to the next then. Is there? Oh, there are some? Okay. See if there's any animal lovers out there. 2 agree, 1 disagrees. So 2 agree that scientists should be allowed to use live animals for research, and 1 disagrees. Okay. The next one, physician-assisted suicide should be a legal option in cases of terminal illness. Physician-assisted suicide should be a legal option in cases of terminal illness. And there's been a lot of play on this lately. There was actually a Frontline special on this about a week ago. Apparently in Switzerland, they have a clinic there which assists people who are in a terminal situation. You can go there and you will be assisted in committing suicide. I guess in this country there are some states where this is legal. But what's your opinion? Do you think a physician-assisted suicide should be a legal option in case of terminal illness? Okay, thanks. Okay, 5 actually agree with this. The physician-assisted suicide should be legal. And 1 disagrees. All right. Marijuana should be legalized. Again, this is something, I think USA Today had an article on this last week about the push to make this happen. Some people think this is inevitable, that marijuana will be legalized. So what are your thoughts on that? Should marijuana be legalized? You could go to stores like the liquor stores here in Pennsylvania, and you go to the marijuana store. Over the weekend, a little recreational use. Marijuana should be legalized. On the other hand, you may think that this is just putting in the hands of people yet another substance that they can obtain easily to be disabled by or to drive under the influence of. Some people think that legalization is a way of controlling drugs. When we had prohibition in this country, alcohol was kind of out of control in some ways. Underground, not regulated, bad stuff being produced, people's health being affected negatively, organized crime coming in a big way. Okay, do we have a count on that one? Okay. We have 2 agree and 2 disagree. That's our most even one yet. Okay, and heroin injection clinics should be established in the U.S. as they are in Canada. As you know, in Canada, they have actual heroin injection clinics where you can go shoot up under the supervision of a nurse. You can get your heroin, your clean needles, and the nurse is there, and you get to shoot up. The theory being that this will control diseases, that people will still be drug addicts, but they won't get AIDS, they won't get other STDs and spread those in society. And so this is a controlled setting where people can inject heroin under supervision. So I don't know about your thoughts on that one. This isn't throughout Canada, but in British Columbia, I believe they have these clinics. Those crazy Canadians, who would have thought? They seem so staid up there and so organized. So we're getting our tally on that one. Let's see if I have another one, or is that the last one? Okay. Here's the last one while you're thinking about that one. Addicts arrested for a criminal offense should be sent to a treatment program instead of jail. Okay, here's our count on heroin injection. Only one person agrees to that. 3 people disagree. Addicts arrested for a criminal offense should be sent to a treatment program instead of a jail. Okay, now each of these, while you're answering, that's the last one. We could talk at length about each of these and come at them from an ethical perspective, because each of them are fraught with ethical thoughts. And we don't have the time to do that. I would encourage you to think about it, maybe have some discussions around the water cooler at work about some of these issues, to test out your own way of approaching these from an ethical point of view, because each of them are kind of fraught with ethical dilemmas of all kinds. Some address the issue of harm reduction, which we don't really have time to go into that a lot here, but harm reduction is certainly something when you think about needle exchanges or even the heroin injection clinics, that the idea is to reduce the amount of harm that's done by these things, understanding that you're not going to stop this, but maybe we can contain it in some way and keep people healthy enough so that if they decide to get into recovery at some point, they haven't contracted hepatitis C or AIDS or worse. But anyway, there's a lot of ethical issues here to think about. In terms of the addicts being arrested and sent to treatment instead of jail, 4 agree, but 3 disagree. That's probably our most contentious one. And part of the reason that I do a values walk like this, and you can see that we didn't have unanimous agreement on anything that people voted on. Those of you that voted. Is that you see that in the addictions profession and in the mental health profession, some of you may be in prevention work or others, that there can be a variety of opinions about things that relate even to our field and, of course, even broader issues. And therefore, that means that all of you are coming at these situations from slightly different ethical stances, and this is fine. This can be good. This can be something that really we need to have in our profession, a discussion about these issues. It also indicates that you may work in the same office and have different points of view. And this can be okay too, that this can be a way to begin to challenge one another and to get each other to begin thinking ethically and to begin thinking in a way that begins to attack issues of importance in a way that may change your mind or someone else's mind in the process, or increase your ability to see things from different perspectives, which can lead to better ethical decisions. Okay, in the time remaining, we don't have a whole lot of time left here, and so I'm going to try to get through a couple more of these slides, but this is a two-part training, and so what we don't get to today, we will get to next time. And in addition, I'll tell you some other things that can happen next time. But what about the law? Okay, laws, here's a little definition of laws. Laws are rules applied to all citizens and held as binding by the state to ensure social order. Okay, so these are kind of external things that are applied to us. We all know when we come to a stop sign, we really need to stop or else we're going to have chaos at the intersection. And some of you who have gone through stop signs, perhaps inadvertently and were in accidents, know that this can happen. So laws are put in place to ensure social order. And laws are necessary to avoid chaos in a community and can protect individuals from each other and even from the state itself. Laws can be frustrating because, they're constrictive. Nothing frustrates us more than when we see somebody that we know has committed a criminal act get off on a quote-unquote technicality. And yet those technicalities are often in the law to protect all people in society. So unfortunately, as it says in the scripture somewhere, the rain falls on the just and the unjust alike. Some people are unfortunately protected who shouldn't be, but others who should be are also protected. Not all laws are ethical, so ethics and the law sometimes conflict. We certainly know this from our own history in this country. We had all kinds of unethical laws on the books when this country was founded, for instance, regarding slavery, regarding the rights of women. There were plenty of laws that restricted rights and in worst case scenario, actually enslaved people. We look back today almost in horror and say, how could we have done things like that? Certainly laws in Nazi Germany that were anti-Semitic and led to horrible consequences. These boggle our minds. How could societies pass laws like this? So we know that laws and ethics often conflict. What often happens in societies is that ethical issues, as a society begins to coalesce around things that they believe to be ethical, that sometimes then bubbles up into the law. And for instance, that's what we saw happen in the civil rights bills that were passed in the 60s, is that the society's ethics began to coalesce around this idea that things like poll taxes, making people pay a tax when they went to vote, things like literacy tests in order to vote, or other things that restricted people's rights, that these weren't ethical. And so as that ethic began to change in our country, then the laws began to change as well. So you can see then how ethics can influence law, but sometimes ethics can be countermanded by law, and you have an ethical obligation at times even to disobey a law, which you won't do without consequence to yourself. But some of our heroes of the past are people who ethically made the decision that they could not obey a law, and so they dealt with the consequences of that. Okay, so that's a very brief look at the law. I do think it's important for us, let me go back to that slide for a minute, to think about law generally in that way. Later on, we're going to get into some specific laws that apply to us as providers, things related to confidentiality, for instance, and other kinds of laws that are directly related to our profession as addiction treatment professionals. And those laws may not be so arbitrary, but this is just a general approach when thinking about law. Okay, let's talk for a minute about healthcare ethics that are based on the 200 BC oath of the Hippocratic School. And this will get us set up for some of the things that we're going to talk about next time. You've heard of the Hippocratic Oath, and these are the kinds of things the Hippocratic Oath is designed to protect. Number one is autonomy. That means the person has a right to make decisions for themselves. The patient has a right to be involved in decision-making that affects them, that we simply can't trick them, as has been done at times in the past in medical history. Where people were tricked into studies that they didn't really know what these studies were. That's not respecting their autonomy, their ability to dissent or say, no, I don't want that treatment, or I don't want to be involved in that study. Obviously, respect for persons. So we need to respect people and to treat them with respect and to understand that they may have different views than ours. This gets into things like cultural sensitivity. It's not our task to impose our culture on someone. It may be our task to know enough about the culture of that person to help them make good decisions within that culture. Confidentiality was something that was even recognized back in 200 BC, that the provider of service, of a health service, doesn't have the right simply to go around talking about what the patient has revealed. Truth-telling. Being able to tell the truth to your patients, being able to lay it out for them. Here's what you need to hear, here's what you need to know. And vice versa, that the patient really should be telling the truth to the provider as well. Non-malfeasance has to do with reduction of harm reduction, making sure that what we're doing isn't harming the patient. And at times we may have to apply treatments respecting the persons, respecting their autonomy, that may just be harm reducers and not really solve the problem. And beneficence is simply looking out for the well-being of the patient who's entrusted to our care. What about our patients, the people who come to us for services? Well, first of all, they aren't well. And that may seem like an obvious thing to say. But at times, our patients can present as though they aren't so bad. I used to reflect when I was in addiction treatment that sometimes our patients actually presented quite well. If we ran an outpatient program or someone was coming in for treatment after work, they sometimes looked better than I did. So it isn't obvious at times, but we should always remember that our patients are not well. We should remember that if we're providers of service, they see us as powerful. They see us as people that, they're depending on in some fashion. And they're vulnerable because of this. So that we have to be aware of that vulnerability and respect it, and we'll see that as we talk next time in more detail. They have rights. And we have to respect those rights and understand that when they come into treatment, they don't leave those rights at the door, that they carry those rights with them into the treatment setting. They can improve their lives. They may not do everything we want them to do, but they can improve their lives and that they can actually achieve a better quality of life for themselves. Okay, now when people come in for treatment, what we're looking for is we're looking to find what has often been called the therapeutic zone on the continuum of professional behavior. And we'll talk more about this next time when we get into certain principles that I'll go over with you. Those principles are called the 11 principles for maintaining good professional boundaries. But you can see on the continuum of behavior that we could either be under-involved with our patients and say, I don't really like this person that much, or geez, I'm tired of hearing their whining, or whatever it may happen. Your 3 o'clock depressed woman that you see every Friday afternoon who doesn't seem to be making a lot of progress, and you find yourself maybe not presenting enough of yourself in that session to be really helpful. On the other hand, of course, you can be over-involved, which can get you into all sorts of ethical and legal trouble if you're over-involved with your patients. And so you have to be careful about that as well. What we're looking for is hitting the target of the therapeutic zone. So that's what we're going to be looking for next time. We're going to be talking about the therapeutic zone. We're going to be talking about maintaining good professional boundaries. We're going to be going into some very specific detail about confidentiality and confidentiality regulations. We're going to be looking at things like record keeping, which I know all of you love record keeping, and the opportunity to talk about that. And hopefully we'll end up by giving you some pointers on how to make good, clear, ethical decisions. It's intermission time, meaning that we're having a long intermission, actually. We're not going to resume until April 14th, so you have time to take care of your personal needs between now and April 14th, and we'll see you back again. If you have questions or things you would like me to address the next time we meet, there's my name, my telephone number, my email address. Email might be the best way to let me know what you think we need to focus on next time, or questions that you might have had that we weren't able to get to today. It's jaiello@ireta.org. Feel free to email me, and I can take a look at those before the next time we meet, and we'll have a chance to maybe address some of those things. Also, at the end of the next session, we'll be emailing out to you a copy of these slides, all of the slides that we just went through and the ones that we're going to do next time, as well as a little bit of a resource list, some places where you can read more about it. And then we'll include on the resource list a really good book that's, I'm going to hold up to the camera. It's called The Book of Ethics, Expert Guidance for Professionals Who Treat Addiction. Sounds pretty relevant to what we're talking about. That'll be on the list as well, how you can get that. So we've come to the end of our time. We didn't give you a break today, so we're trying to be ethical and give you the whole 3 hours, because we know that some of your states require 3 hours worth of ethics training for you to maintain your certification. But we can end a few minutes early, and I do appreciate your involvement and your comments, and hopefully we've given you some things to think about for now, and hopefully we'll see you again in April to finish up our discussion of ethics as it relates to addiction treatment. Thank you very much.